Good morning and welcome to Samantha Dunbar Inc. My name is Dr Trent. I'm a director and biokineticist at the practice. Today we have Dr Jerome Mampane with us, and we're going to be asking him a couple of questions about what he does and how he goes about his daily practice. Jerome, welcome. Good to have you here.
Roger, thanks very much for having me.
Excellent. So I think we're going to get started and just ask you, what do you do on a daily basis? So you give us a little bit of a bio about yourself and what you're doing at your practice currently.
Yeah, been in sports medicine private practice for a short while now, but been involved in sports for even longer. And I think opening Sports Medicine Africa, the idea was just for us to be able to help the general public in terms of their activities, their pre-participation in sport, their injuries, and their return to sport. The idea was always to help high-performance athletes return to their best levels that we can. The joy is that we've also gotten to work with the elite athletes on a significant level, actually.
Do you have a specific focus in your workers? What gets you out of bed in the morning?
I think it's significant for most of us at the practice. We enjoy working with high-performance athletes, but it also is quite a joy to be able to work with the regular weekend warrior and to help them achieve what they're looking to achieve.
In terms of your exercise medicine practice, where do you think physio and bio would fit in terms of the modalities?
Yeah, great question, and thanks for that question. I think there's great value in the integration of the services between the two because it's about the holistic care of the patient, and I think that's where the services, when you see them each, fall into that. You need to understand that perhaps we may be either a front-line exposure, so a first-line exposure, or even a second-line exposure as a referral point. But the idea is that the patient then gets the holistic service either starting through the doctor or being referred through the doctor, coming through physio, and then completing their rehabilitation processes through bio. So there's great value in the services, I think, working together.
In terms of the current pandemic that we are facing, what would your top 3 tips be for the general public?
Yeah, Raj, thanks for that question. I think it's good to reflect on that because just where we are in the country at the moment. On this topic, I think it's good to point out the measures that have been suggested by the NICD as well as the Department of Health. But I think the primary thing I feel strongly about is that people need to be educated about our behaviors and the things we do, because we need to change our behaviors when it comes to this pandemic. How we wear masks, how we show social distance. We need to understand the reasons behind the things that we do. Why do I wear a mask? Why do I wear it over my mouth and nose and not just letting the tip of my nose stick out? We need to know why we should social distance, so that at least when we do these measures, it isn't something that is just done out of a compulsion or because someone else told me, but there's an understanding that there's value in my distancing socially because this will help save lives, and the purpose of it is that I don't pick up this virus.
During this pandemic, exercise and nutrition are very important aspects of staying fit and healthy. What is your perspective on these aspects?
Yeah, I think a very good question. Exercise and immunity go hand in hand, and there's great value, I think, in building up your immunity, I think, being involved in exercise during this time. And also, it also deals and speaks to quite a forgotten area with regards to this pandemic, which is people's mental well-being. And I think mental health is one of those areas that we're forgetting about in this pandemic, especially where people have quite a lot of concerns, death being one of those, not just death, but financial constraints. So there's value from a health perspective, whether it's your immune function or whether it's your mental health, in actually just staying active during this time.
Thank you. Last year you were involved with the Springbok World Cup winning side. Congratulations on that.
Thank you.
I think some people would see that as the epitome of their career. Where do you see yourself going in the next 10 years?
Well, I thought I'd be Kanye West's partner at the White House, but you never know with these things, right? No, 10 years from now, I think I'd like to see Sports Medicine Africa, I think, as a brand around, just around Africa. I think that's why we named Sports Medicine Africa. But the other thing I'd like to see for the Springboks to have had quite a couple of victories over New Zealand. I'd like for us to be at number 1 still, and I'd like to see us just beating England every year. That's what I'd love to see every year. It doesn't matter, I guess, which year it is. But I just want to see myself maybe giving a greater contribution in literature. I think there's value in helping in that, and I think also just a greater contribution in community sport. Seeing that the underprivileged communities actually have access to the kind of services that we offer, sports medicine, physiotherapy, biokineticists. There's great value because there's a need for understanding in amongst our people to know, that they should know why these services are out there, and actually that they can use them to help them return to full health. I think that is big on our hearts at the practice as well.
Absolutely, totally agreed. Thank you. We'd just like to thank Jerome for being here today. Thank you for his insight, and hopefully you have gained some perspective into what sports medicine and how we interact as bios and physios with the doctor. Stay tuned for more because we will be interviewing Jerome again and hopefully gaining more insight into aspects of sports medicine.